Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Doctor, thank you for being with us this morning.
Good morning.
Officials say they're hopeful they see the end of the pandemic in sight. Is that true, or are they not taking into account these new variants?
All pandemics come to an end, and this is going to come to an end too. The question only is when, and certainly the metrics are going in the right direction.
And Dr. Fauci said this weekend that we will be wearing masks into 2022. Are you surprised by that comment?
No, not at all. Because like they do in Australia, New Zealand, Hong Kong, Taiwan, places where they've controlled the infection, you have to basically get it down to zero. We don't get it down to zero, you're going to still be wearing a mask. So the closer we get it, the sooner we get it to zero, then we can take our masks off.
Let's talk about COVID infections in children. A new study says that 75% of the children who have died of COVID are children of color.
Yeah, it's really very, very sad. First of all, it's only 250 or so or less children have died from COVID. So, I mean, that's the encouraging news. Kids can tolerate this infection better than adults. However, if you look at the mortality, it's just striking. The number one group for deaths in children are Hispanic people, and followed by African Americans, and then Native Americans and indigenous peoples. So it's just a staggering figure.
Let's get to some viewer questions. There is information going around that the FDA is alleging the first dose of vaccine is 92% effective, making people question if a second dose is necessary. True?
Well, no, the second dose is necessary. It's absolutely true. Almost all vaccines have a booster dose. This is just part of the whole immunology we've learned about in many different vaccines. What they're referring to here is really in a kind of more of a laboratory experiment where they tested the immunity in people that had one dose, and they found in Israel and in Canada studies there that really there was 90% protection, but isn't in a test tube. In clinical trials, we don't really know. There haven't been that many. We know people get COVID after the first injection. They're at higher risk than after the second. So you need the two doses. I think the real topic for discussion is when that second dose should be. Maybe it could be in 2 months or 3 months so we can get more people with at least some protection with this first dose. But I think you're going to always need two doses.
All right. Next question. Over the last month, Illinois long-term care facility COVID deaths have dropped. Does this show that vaccinating the most vulnerable is already having a huge effect, even though we are nowhere near herd immunity?
Absolutely. I mean, the people living in long-term care facilities are the ones with the highest risk for death because they're older, they have underlying conditions, they are just targets for this virus. And vaccinating them has always been a priority, and whenever that backs off, the death rate goes up again. So it's been a big success where they've been able to implement that.
All right, and the next question. In the past, you have said the chances of spread in the outdoors is minimal based on masking, distance. As Chicago beaches were closed all last summer, if you were to advise Mayor Lightfoot, would you say the beaches are safe for the upcoming season?
Well, I don't think Mayor Lightfoot really cares what I think, but being outdoors is pretty safe. And I think one thing is you can't have a beach that's totally packed. I mean, along the lakefront, I mean, in the summertime on a nice day, that thing is packed. I think some kind of limit has to be put in place, but I think the beaches should be open.
All right, Dr. Murphy, thanks again for joining us. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good